My name's Elizabeth Burrows. I founded Burrows Consulting 11 years ago and have had the honor of serving FQHCs, hospitals, community mental health centers, rural health clinics, and STI Ryan White clinics throughout my career. We help people get FQHC status or Ryan White lookalike status, mainly for higher reimbursement and or the 340B drug program, and we also write grants for healthcare entities. I'm happy to say that there are now some federal grants available, and we're dealing with some federal grant deadlines today. So hopefully, if you have those and you're multitasking, I totally understand because I know there's some healthcare grants due today that potentially were maybe only announced within a week or two ago. But again, we're happy to know that the federal grant moratorium is over, and we're here today to talk about federal grants. Callie's with me. If you haven't met Callie, you're missing out. She does all of our social media, PR, and a variety of other tasks. She'll be manning the chat. So if you have questions, feel free to email Callie or you can put them in the chat and we'll make sure to get those answered. I know we also had some questions that some of you put in registration, so we'll make sure to address those as well. So again, thank you for your time. I know it's a Friday in the summer, so to get a great attendance like we have, I know this is very relevant to what all of you want to hear. So I'm going to jump to it. In addition, Callie, I know they'll be getting the recording, is that correct? And the slides sent after the presentation. So we'll try to get those sent to you as best we can. If you don't get them, we'll make sure you have Callie's email and my email in the chat, and you can email us if you don't receive them in the next day or two. But again, thank you for your time, and we'll go ahead and get started. All right. Well, the service area competition grant, and this is old for most of you. I know I see a couple of you on that have probably been writing these longer even than I have. I think I wrote my first NAP in 2007, so that gives my age, and then wrote SACs every year, I think, after that. But some of you may even have written them longer than I have, and that's why we're old and we call them SACs, which is service area competition. Today, we're going to talk about a lot of the changes to the program. So I will tell you, I've been writing them for, almost 20 years, and I felt like I knew the SAC competition. And then 2025 has hit, and the SAC competition is completely different. So again, we're going to focus on addressing the differences and go over that. If you have no idea what a SAC is, I'll quickly say this means that you are a full federally qualified health center or it's a way to become a full federally qualified health center. So anybody who's ever gotten a NAP, a new access point grant, in the past has then, after they've gotten that money for their community, rolled into a SAC or a service area competition. Now it is expanded eligibility. In the past, the SACs were set up such that whatever FQHC got it, so I ran Valley Professionals Community Health Center. When it was Valley Professionals time for the SAC every 3 years, I wrote that and kept getting money. You also, that money rolls in if you maybe got expanded hours grant last year or you got a behavioral health expansion grant, 5 years ago, that may have increased your SAC award. And you continue to reapply for that every 3 years. There are now changes. Lookalikes and nonprofits can now apply, which is they're actually encouraging lookalikes to apply if they're serving that area or can meet patient targets and are willing to serve that area. So when you're looking at this and saying, can I serve that area? You are thinking of probably being able to do that by summer or fall of 2026 based on the deadline. So I don't want anybody saying, do I have to do it next week? I had somebody ask me that. No, the applications are going to be due this fall, and then you would need implementation by late summer, early fall of 2026. There used to be automatic points for the current awardee, which did not really encourage lookalikes or other nonprofits to apply, and that is now gone. Okay. So if you are the current grantee and you think, oh, I just write this the last week before it's due, I throw it together, no big deal, I'll keep getting my money. That is not the case anymore. I would highly advise that you work with someone who has experience with this or that you get started on this right away. Awards can now be 1 or 4 years. In the past, it was 3 years, so that's a difference. And I know there's some people who expected their SACs to be due this year, and they may have gotten an extension. We've had some clients that did get the extension and some that did not. And I am not for sure what the method behind the madness is, but again, always check your email and your spam for those NOAs to know that. All proposed sites that we're talking about opening in these grants have to be open within 120 days of the award with full hours and services within a year. So again, people say, well, I want to serve there, but maybe I can't have my clinic built. That's fine. Maybe you do a mobile unit, a temporary site. There's ways that we can work with you to give you ideas, or you and your board can work out some ideas to make sure that you have time within 120 days of that award. A lot of the awards are starting around like May 1st or April 1st of 2026, and then you have 120 days after that. But again, a full year until 2027 to be at the full capacity. I'm going to say this once, but I should say it 8 times. Patient targets are important. I remember when in 2018, 19, they started saying, oh, I think patient targets are going to be important. We're going to start reducing grants. And then COVID hit and everything changed. I will tell you, this is the most focused on patient target SAC, NAP, any of the FQHC applications I've ever seen. And now cybersecurity requirements are now mandatory. This is new. If you're a current FQHC and you say, I got time to think about this, I'd start looking at cybersecurity, making sure you have your policies and procedures in place. Again, just a reminder, if you do have questions, put them in the chat or email Callie, and we want to get to those toward the end of the call. Funding priorities and services. Again, they want to see either that you have grown or that you have been neutral toward your 3-year trend. And I've had clients call me, or people through my website are saying, well, my patient target increased by significant. Can you tell us why? My patient target decreased. I don't know why, other than I think everything is running through the GeoCare Navigator tool, and they're looking at patient population needs. So again, make sure to pay attention to those patient targets. That being said, I don't want Callie to say, well, there's no way I'm going to apply. I can't hit that target next year. No, you have until 2030 to hit that target. Isn't that crazy that we're saying 2030, by the way? That seems a little crazy, but you have until 2030 to be hitting that patient target. And again, there's all kinds of things that we can help you do to increase patient numbers or give you ideas. So reach out to Callie or myself if you have questions about that as well. They are emphasizing patient-centered medical home. I remember when I was a CEO and we got Valley Professionals patient-centered medical home before it was cool, and people said it's going to catch on. Well, it has caught on, and a lot of health centers and hospitals and rural health clinics are getting patient-centered medical home. But it does say sites with PCMH recognition gain funding priority at HRSA review. It doesn't say how many points or how that's going to be viewed. But if you are PCMH, or if you're thinking, oh, well, can I get PCMH? Should I do it? Again, I would say this is your sign to work on it. If you know your SAC is out 2 years or something, I would definitely make it a priority. Add it to that strategic plan, because they are making it a priority. This is the first time I've seen HRSA write that PCMH is giving funding priority. I mean, they've been supportive, they want you to do it, but this being so explicit. They're also encouraging services such as nutrition counseling, cancer screening, chronic disease management, and mental health services. These are the high priorities for the administration, and our guess is this goes along with the Make America Healthy Again initiative, the MAHA initiative, and this is what you hear a lot from people working at HHS and HRSA. So that's my best guess, is that it goes along with that, but there is a big focus on these 4 elements. For me, 3 of the elements have been focused in the past. The nutrition counseling is new. Uh-oh, Callie. Okay, here we go. All right, we'll go on. So award periods and funding, again, it depends. The funding is dependent on audit and compliance. If I had to summarize this application up in one word, I would say compliance is the focus. If you would have asked me last year, SAC, I would have said need. Okay, so that's just my own personal 2-cent opinion. But again, they are all about audit and compliance, including your financial audit. There could be supplemental funding possible based on appropriations. So again, if you're a lookalike or you're another nonprofit and you're like, should I go after this? Yes, because this could put you up for a lot more grants, and it also would give you full FQHC status to apply for the free medical malpractice insurance. 1 or 4 year award periods are possible. And if you look at the details on the SAT table, which is service area announcement table, there are some asterisks that show there are current entities up for 1 year awards. If those are in one of your areas and you're thinking, should I go for it? Should I not? 110% you should go for it. But we do encourage you to compete and go for them, even if they're outside. And I'm going to talk a little bit more about the competition factor in a bit. The budget must include your federal and non-federal funds. So that's normal. That's really not new. But again, just ensuring that. Again, the 120 days, we've talked about that. You have to meet staffing and service commitments within a year of your NOA. You could get a 180-day extension if they're not open within 120 days. So HRSA is already giving grace to the newbies. Now, what's that mean? That means, again, they're already saying they're expecting people to compete and open up new sites, maybe instead of the current FQHCs. If you are the current funded FQHCs, missing any of these deadlines could put your funding at risk. I know I've heard Tanya Bowers from HRSA talk multiple times saying many FQHCs miss their grant deadline. If someone else applies, it automatically goes to the new grantee. So again, stay on top of that. You don't want to miss a deadline. And then if you are a new awardee, you will have an OSV, which are our favorite things, operational site visit within 24 months of the award. They did change. So it used to say that you needed to have your sites over 40, at least one site. Now it says a minimum of 40 hours per week. So that's a change. Another big change is they are allowing multiple applications under the same UEI if you're serving different service areas. So again, one entity could apply for 8 SACs, 2 SACs. In the past, they wanted it to be the one UEI and it might preclude you from that. That is not the case now. Okay. Management and government. Again, they are now saying the CEO, CFO, and CMO must be direct employees and not contractors. That's new. We've seen it with the CEO. We have not seen the requirement with the CFO and CMO. The board has to avoid conflicts of interest and reflect your community, and the governance policies must ensure oversight and fiduciary responsibility. Again, compliance, fiduciary responsibility, financial audits, all of this is really important. The compliance and reporting, again, you have the required reports. If you are up for a SAC or you think you might be make sure you log into EHB. Make sure your username and ID are up to date. Make sure if you have a late report that you're going to work on that. Click the tasks. Sometimes they don't come up. It's amazing what people have found in EHB in the last week or two that may not have been there before. I know HRSA has been working and things have been changing. So again, log in and check. Start reaching out to your PCA and your health center controlled networks, asking them for letters, getting partnerships. There's a focus on that. And again, nominal fees for patients less than or at 100% of the federal poverty level must be minimal and clearly documented. I can tell you from our experience with lookalike applications in the past 6 months, there is a huge focus on board minutes. I can't say it enough. Board minutes. I'm just going to throw out. If you want to know on your OSV that you're going to have within 2 to 4 months, if you are a new awardee, the one document that all 3 reviewers get is the board minutes. So I would definitely be talking about federal poverty level. What's our nominal fee? Is it minimal? Is it documented? Is all of that being followed? I do see there's a question in the chat. Where in the EHB do we find the HRSA specified patient target? I don't believe that is in the EHB, Natalie. I do believe it is on the SAAT table. We can send a link out following this, but if you want to Google while you're talking to me, if you type in SAC space SAAT, it will come up and you can look for your base city. And the patient target will be there along with the services that you provide. So if you're the renewal applicant, it should not be new. If you are thinking of competing, then you need to look and make sure that you can not only meet the patient target, but also provide those services. If you have any issues with that, you know how to find Callie and me, and we can help look that up for you. Again, the budget and program income, there are strict program income rules. I advise that you read that. Those are changing. So they're updating that. And again, if I give you another piece of advice that you want to take with you besides the board minutes is I would not download the instructions and save them or print them and go and work on the application. My favorite thing when a grant came out and a NOFO came out, and if you used to write grants, you probably appreciate this. I'd print it out. I'd put it in a binder. I'd get all my colored tabs, all my colored highlighters. I'd get so excited. The budget areas were all green with the tabs, and I'd highlight the budget part in green. My response was always pink because that was my favorite part and that's my favorite color. Okay. And I would be highlighting and going, and I would use that until the day the grant was due. I highly discourage that. And again, that's my favorite thing, and I'm not going to do it. I literally still continue to Google it or go to the link and re-download it daily. There are changes occurring. Someone told me, well, they have to put on the dates when they change them. We have noticed changes without them saying updated on this date. Okay. So I'm just throwing that out. That again, it's highly important. Um, to keep looking at those instructions because they are changing and they are changing really minor details. So I'm just throwing that out. Um, that don't do my old practices. I'm not doing it either, and I'm not saving the PDF. I go back to it daily to make sure that I'm following every bit of instruction. Okay. And then budget narratives must be clear and indirect costs may use your approved rate or the de minimis, and the de minimis has increased. So again, that's something else to stay on top of. I know the de minimis, there was confusion in 2024, whether it was 10%, 15%. Again, stay on top of that if you want to use that rate. If you don't have an indirect cost rate that's already approved, I would say it's probably too late to get it approved for this grant, but you could go ahead and work on that approval process. Okay. Cybersecurity. This is new. You have to develop and maintain cybersecurity plans. Again, this is in a grant, so you're going to say we're going to do this. But again, if you know your SAC's going to be up next year, you want to go ahead and get ready, this is something you can start working on. You have to ensure we're protecting patient data and you're complying with HHS requirements, and you're going to have to show proof of that in your narrative. So again, this is a new focus. I don't think I have seen this before. If you have seen it in a grant before, I'd love to share it with me because that's great information. I know they've talked a little bit about emergency preparedness, including things with your computer systems, but this is the first time I've seen such requirements and that you do have to have a plan. Again, risks of noncompliance. You cannot, 2 consecutive years of noncompliance can lead to no award. So if you're looking at the SAAT table and there's an asterisk and they're on a 1 year, if they are on another 1 year, that can be a problem and you could get defunded. I did want to share, somebody told me I shared this with them earlier and they said, well, you're the bearer of bad news today. And I always like to be positive and we just want to get money for our amazing healthcare providers that serve the underserved. But I just want to be clear, in the past, the SAT table has been red, yellow, or green. People would come to me and if they were in green, I would not write their SAC applications because I just said, well, it's not really worth it for you to pay me to write this because they'll keep funding the current grantee. I know of multiple examples in 2024 where there was a grantee in green and they lost their funding because another FQHC, another nonprofit, another healthcare entity applied. We did not write any of those competition ones. We wrote for current FQHCs and were highly successful, won all of them. But again, I just want to be clear that, there were people that were in compliance and still lost their grants last year. So again, I'm not trying to scare people or be the bearer of bad news, but that is important. Sites not operational within the deadlines risk award termination. In my experience, as long as you are talking to HRSA, if you get your extensions, they will approve those. You can apply for those. But again, you do need to be in communication and trying to hit those deadlines. Poor reporting or audit failure, meaning that you have a lot of issues with your audit or the OSV, this could impact future funding. Again, if you're struggling with the SAC or compliance, reach out to us anytime. We're always here as a resource. Next steps. I can't emphasize this enough. The SAC is highly competitive. I remember when, again, people could write just a few pages and they're like, oh, my project officer knows me. This is easy. They're going to keep funding me. They know our great work. That's no longer the case, unfortunately. So you want to start planning early. And applications are due this fall. I did not want to put exact due dates because I know they have been changing slightly. The first part is the grants.gov part, and you have to have your budget done. In the past, I know people could change their budgets in EHB. We are not sure that's going to be the case this year, so I would work on getting that budget finalized, your grants.gov done so you can open up the EHB. Please be thankful. We are writing grants right now that are getting submitted today that were announced 14 days ago through SAMHSA. I have heard there were DOT grants that were open for 24 hours on a Friday night to a Saturday night. So even though I am the bearer of bad news a little bit, I'm also the bearer of good news because at least we do have our full 90 days. These were announced July 22nd, and many of them are due October 22nd. So again, we are getting some time to be able to get these done. So that's a positive. If you want to talk to us about your patient targets, readiness, or help with an application, we're glad to do that. Again, make sure you can check, log into EHB, look at when yours is due, check the SAT table for areas that you could be applying for if you are interested in this. And again, if you have questions, we are here to help. I will say, just to clarify your question, Madeline, that I see came through on the chat. The question is, I thought I read this only applied to nonprofits and tribes. Is that true, or does it also apply for for-profit businesses / rural health clinics? To become an FQHC or to apply for the SAC grant, you do have to be a nonprofit, tribal, or a public entity. Public entity is a public university, or if you're like a local mental health authority, a hospital district, if you are considered county or state by your state or local authority, that is a public entity model, and you also can apply, as well as 501c3s. And that includes hospitals, hospitals, there's certain rules around whether hospitals can apply, but there are ways around it. Reach out. That's a complicated answer. But again, community mental health centers, nonprofit clinics, nonprofit organizations, entities, anybody that wants to get into healthcare and serving people, this is an opportunity for them. Okay, can you confirm if the 1-year extensions have gone out? I cannot confirm or deny that. We do know we've had clients that did receive a 1-year extension, and we have some that have been told they should get it and they may not. I encourage you to reach out to your HRSA project officer to find out. If you are a period, Amanda, if you want to go ahead and email Callie and me just so we can get with you directly to try to find out your area and to check on that in the background, we would be glad to do that or set up an individual Zoom. We also have a couple clients who also had 12/31/25 project period ends that have not received notice that their SAC is due. They don't appear to be on the SAT table, and they have not gotten a 1-year extension. So again, I encourage them to reach out to their HRSA project officer on their most recent NOA. But Amanda, we'd be glad to connect with you directly and talk with you. So you're not on the SAT table either. I can say I had a client today that had reached out and they had seen a site that was open in, I believe, Queens, New York, and they told me it was open. And when we looked at the SAT table today, there was nothing in Queens. We did a search for Queens. We looked up 3 different ways on the SAT table and it was no longer there. So as I told the client today, maybe the SAT table is ever changing too. So again, just trying to monitor that. And again, I would probably reach out. If I were you, Amanda, I'd reach out to your project officer on your most recent NOA through the SAC grant and ask about that. Any other questions? You can unmute, or Callie, you may have had questions come through.
We did have one come through, which was, what are the most common ways you lose points? Honestly.
Okay. Yeah, I'm glad to tell you. So again, in the past, one of the common ways people lost points is they weren't the current grantee, and I can't emphasize enough, those automatic points are now gone. There also is a lot of the needs. So people got points through needs. There is still a need point, but again, the needs narrative has been dramatically reduced and compliance is now the focus. So again, just to give you an idea, our needs sections were usually, 5 to 10 pages, maybe more of a SAC. I mean, now I'm guessing I haven't wrote the under the new NOFO, but it's probably going to be 1 to 2 pages, to be honest, of the need. So again, it is based on the mapping and the data and not as much on the needs research and needs narrative. How else do people lose points? The number, and I get asked this a lot. I've already been asked this once or twice today, which is, would you do part of our application? Can you write the narrative and we'll do the rest of it? I have heard HRSA talk about this, and I know this from experience talking to other clients that have worked with someone else and then come to us. And there are consultants that will just do part of it. We don't. We do the whole thing. And here's why. Number one reason an application isn't funded through HRSA, and this is over all of HRSA, which includes the SAC, is something doesn't match up. So, in other words, the project narrative doesn't match the abstract, doesn't match the budget narrative, doesn't match Form 3, doesn't match Form 1A, doesn't match the budget justification attachment. So, again, a lot of us, and I know I did this too, I was like, okay, we'd sit down with our leadership team and I'd say, well, I'm the CEO, so I'm going to write the project narrative. CFO, you're doing budget narrative. Okay, our outreach coordinator is going to do Form 1A and Form 10 or whatever. Okay, and they're going to do the attachment 1 and 2. No, I mean, that's what I'm going to tell you. You really need one cohesive group checking, double checking, and triple checking to make sure everything does match up and align. If you are not on the table, there will be other opportunities. So there will be additional SAC grants available. If you're interested, we are also keeping a list of people that want us to write with what's open now, and then they want us to write in the future or watch for certain zip codes. Please email Callie and I. We will track all that. We would love to be help watch these for you or as you see them and change if your area is not on there. You also could look and maybe you say, Idabel, Oklahoma isn't on there. Ken, I don't know if I pronounced that right, but you might say, well, that's not on there. Or also use my town, Cayuga, Indiana isn't on there. That may be the case, but they may be on there for another health center. There are a lot of health centers out of Chicago that manage health centers through Southern Illinois, 4 and 5 hours away, 2 hours away. Okay. So you also need to look at their map and their service area. The address is just based on the main site that originally applied. So there may be money and may be serving other areas. And that's where we can help you do some strategy, and it does take some work. Someone said, well, why doesn't it say who the current grantee is? They don't really produce that, and you have to do some digging and some little detective work and investigating to try to figure it out. And I don't know that there's a perfect way to figure it out. We can give you some really good educated guesses. Additional questions?
We have, how should we handle changes to our service sites or services that have occurred mid-grant cycle?
Well, I can't emphasize enough, and many of you will know this, FQHCs live and die by Form 5A, B, and C, their services, their sites, and their services provided not at one of their sites, or as HRSA calls it, other activities. You need to check that and make sure that is as compliant as possible. If you need to put in changes in scope, you'll want to get started on those and make sure that is complete, and make sure everything is up to date as you are applying for the SAC grant. Make sure your hours are up to date, the addresses and everything, because again, you're going to want to make sure everything matches up perfectly. Well, again, we appreciate your time. We wanted to try not to take too much of your time because I know it's a Friday in the summer. My kids go back to school next week, so I know many of yours might be doing the same thing. Please reach out. You have our emails, you know how to find us. And again, thank you for joining with your valuable time. If you want to stay on, I will continue to answer individual questions or meet any of your needs. And again, we appreciate you. Keep doing the great work of serving the underserved throughout our country. And if we can, my team or I can ever be of assistance, we would love to work with you. Thank you. And if anybody else has questions, you can unmute and we'll answer your question. We're glad to do that.
Elizabeth, may I ask a question?
Sure.
This is Melanie Canatzer from Suffolk Community Care.
Hi, Melanie.
How are you? Thank you for this webinar. I was looking at the SAT and noticed for Chattanooga that it's only listed for homeless population. And
Hmm.
then I know patient target is very important.
Hmm.
Does our target number need to, I guess I'm reading that right, it needs to at least be 75% of what that number is listed on the SAT?
Yes. And as
Okay.
much as you can try to hit that, that would be the goal for sure. Now,
Okay.
I do want to be clear, HRSA takes a very broad definition of homeless. Okay. So homeless really includes doubling up, housing insecure, living in something that has wheels, things like that. So again, definitely check HRSA's homeless definition because if you are concerned about meeting homeless goals or serving the homeless, my guess is you already are serving them in some form or fashion and just maybe not tracking that.
Oh,
Um,
thank you.
mhm. Because again, many of the patients that FQHC serve are housing insecure. And they've even expanded the homeless definition more. That's why I say to check that. Because I think now it's like, are you within, if you lost a job, are you within 60 days of being homeless? Something to that effect. But again, we're working against a moving target as well on that. So,
Perfect. Thank you.
mhm. Any other questions? All right. Well, thank you so much. Reach out to Callie and I. I know a couple of you put that in the chat. John will try to capture that for you and follow up via email. Um, so glad that you joined us. Again, I know it's valuable time. Good luck on your SAC applications. Let's get money for these FQHCs. We've been waiting on this money for a long time, so let's make sure we do an amazing job and get money for our patients that need us. If we can help you, we would love to. And everyone have a great weekend.